Hello, my name is Liliana Romero, and today we'll be talking about overcorrection in enuresis. The contents of today's PowerPoint will be introduction, key metrics, technique, and conclusion. What is enuresis? Enuresis is an elimination disorder characterized by involuntary release of urine. There are two types, diurnal and nocturnal, which is a primary problem for approximately 26% of all children referred to a psychiatric treatment. Regular and irregular enuresis. Regular enuresis is wetting that occurs daily and is never self-initiating, meaning the child never consciously decides to wet themselves. Irregular enuresis is wetting that occurs sporadically and self-initiates some of the time, meaning the child wets occasionally, random times of the day, and they do self-initiate or consciously decide to go restroom when they want to. Previous attempts and training. Through my research, I have discovered 3 different attempts to prevent, reduce, or remove enuresis in children. The first is operant conditioning that uses verbal praise to reward the desired behaviors. Number 2 is classical conditioning, a method designed by Van Wangenen, Meyerson, Kerr, and Mahoney. An individual is trained to respond to a tone. The conditioned stimulus is the tone. The conditioned unstimulus is the urge to urinate, and the unconditioned response is to wake up. The third method is the reinforcement scheduling method, developed by Fox and Azrin, which consists of placing the individual on the toilet at regularly scheduled times throughout the day. Overcorrection. Overcorrection is a behavioral modification technique where the individual is trained the correct behavior or correcting the damage caused by that behavior. In previous studies, especially made by Fox and Azrin, they have included overcorrection as part of their total treatment package. But psychologist Barry Carroll Barman studied the efficiency of overcorrection combined with verbal praise in toilet training developmentally disabled children. If pants were dry, then verbal praise would be administered. If pants were wet, overcorrection was administered. The purpose of the present study by Barman is to test the efficiency of an overcorrection procedure. In Barman's study, overcorrection required the individual to obtain a towel, clean up the accident, rinse the towel, go put on a clean change of clothes, carry wet pants to the sink, wash the dirty clothes, then dispose of them. It was also followed by restitutional overcorrection. Restitutional overcorrection included the individual walking to the toilet, lowering their pants, sitting down for 3 to 5 seconds, arising, then raising their pants, returning to the location of the accident, then repeating the steps 10 times in rapid succession. As shown, you'll see 2 charts. One is a baseline condition and the other is the treatment condition. In the baseline condition, we have pants check, dry pants, and wet pants. And in the treatment condition, we have pants check, dry pants, wet pants. But you'll notice in the treatment condition, there's a step for overcorrection, whereas in the baseline condition, there's not. Conclusion. The major goal of the study was to teach the subjects to completely and appropriately toilet themselves on an independent basis. The results of Barman's study indicated that the procedure was successful in eliminating diurnal enuresis in 3 out of the 4 children he experimented on. Data through the University of the Pacific Thesis and Dissertations of 1979. Thank you for your time in learning about enuresis and overcorrection, and how one can use overcorrection to treat such a common problem found in children, teens, and adults.